Okay, my name is Heun. I'm consultant psychiatrist, professor of psychiatry, and editor of Global Psychiatry Archives. And without just waffling around, I just want to come to the selective serotonin uptake inhibitors explained today. They're usually called SSRIs, to make it short, and they usually do what's in the tin. They inhibit the reuptake of serotonin in the synaptic cleft, and this leads to increase of serotonin in the synaptic cleft. And there's an 5-HT1A, that's a specific receptor agonism, which leads to antidepressant, anxiolytic, anti-obsessive, compulsive, and anti-bulimic effects. There's also an 5-HT2 antagonism, which may lead to agitation, akathisia, anxiety, panic attack, some insomnia, and sexual dysfunction. And there's also an antagonism at the 5-HT3 receptor, which might be leading to nausea, gastrointestinal problems, diarrhea, and headache. So what we want is more or less a 5-HT1A agonism. Compared to other antidepressants, dosing is quite easy. The medication is easily tolerated, much more tolerated than the classic tricyclic antidepressants. And the best thing, and this is why it's prescribed so often, that it's hard to overdose with SSRIs because they're low toxicity. They don't have cardiotoxic effect, or much less than normal tricyclic antidepressants, and they have few anticholinergic side effects. Disadvantage is that they sometimes, not too often, can cause nausea, gastrointestinal problems, some headaches, restlessness, insomnia. And some people say that in severe depression, they're not as efficient than the classic ones. Usually you shouldn't give SSRIs when someone has a manic episode, and usually there shouldn't be very careful. You should be very careful if you take monoamino oxidase inhibitor at the same time, because this can lead to serotonergic syndrome. Okay, so one of the other cautions or problems is that some of the SSRIs affect the hepatic enzymes CYP2D6, and especially also P460, also called. I can explain this in another video, but essentially is that the P450 refers to the color and to the absorption of the color in this range, and the name CYP2 is more or less a name for a receptor. Anyway, okay, so sometimes it can happen that some medications or some vitamins or other drugs are needing these enzymes and receptors to undergo liver metabolism, and if these medications have a very low therapeutic range, there might be problems with that. Interactions are with alcohol, anticoagulants, anticonvulsants, antipsychotics, benzos, beta blockers, bupropion, buspirone, cimetidine, ciprofloxacin, hypoglycemics, lithium, methadone, monoamino oxidase hammer inhibitors, morphines, and smoking, tricyclics, theophylline, and warfarin. So there's plenty of interactions, which makes the SSRI sometimes some medication for the younger people, because they don't have all these side effects and profit well from an antidepressant which doesn't have any risk or very little risk of overdose. Most of the SSRIs have very limited differences. However, one of the big differences is that some of them have an extreme long half-life. So the fluoxetine has a quite long half-life, up to 5 days, more or less. No, yeah, up to 5 days, 4 to 5 days, and or between 24 and 140 hours. So some of these medications can be very agitating. Citalopram and escitalopram are quite linked. Escitalopram is the active enantiomer of citalopram, so it's a part of the mixture. Citalopram itself is S and R citalopram, and escitalopram is more or less where the R citalopram has been taken out. Works quite well against depression, panic attacks, agoraphobia. Fluoxetine is more or less the same. Sometimes it's given more for OCD, obsessive compulsive disorder. Some people see OCD also as anxiety disorder, because when people are inhibited to do their compulsions and other actions or ruminations, then they might have anxiety. That's why OCD is seen as an anxiety disorder, at least in older classification. Right, sertraline is usually a medication which has more or less the least side effects and is possibly the most tested in the elderly. There's a paper which was published in Global Psychiatry Archives from Mate, seeing that sertraline is the best one which has been tested in the elderly. Right, this is more or less it. I hopefully haven't waffled too long. I hope you enjoyed this. You can read all this up. There's no secret in this. However, I give you the essentials in minutes. Okay, have a nice day and enjoy the evening.